Hello, and welcome to another presentation of 5-Minute Cybersecurity. Today we'll be discussing the Health Insurance Portability and Accountability Act, otherwise known as Hipaa. My name is Bill Osolinski. I'm a certified information systems security professional with 30 years experience managing IT systems. So what is Hipaa? The major goal of the privacy rule is to assure that individuals' health information is properly protected while allowing the flow of health information needed to provide and promote high-quality health care and to protect the public's health and well-being. It was enacted into law on August 21, 1996. Who is covered by the privacy rule? The privacy rule applies to health plans, healthcare clearinghouses, and to any healthcare provider who transmits health information in electronic form. Health plans are individual and group plans that provide or pay the cost of medical care. Health plans include health, dental, vision, prescription drug insurers, health maintenance organizations, Medicare, Medicaid, and long-term insurers. Healthcare providers, regardless of size, who electronically transmit health information in connection with certain transactions are considered a covered entity. These transactions include claims, benefit eligibility inquiries, and referral authorization requests. Healthcare clearinghouses are entities that process non-standard information they receive from another entity into a standard or vice versa. In most instances, healthcare clearinghouses will receive individually identifiable health information only when they are providing these processing services to a health plan or healthcare provider as a business associate. Business associates are either a person or organization other than a member of a covered entity's workforce that performs certain functions or activities on behalf of or provide certain services to a covered entity that involve the use or disclosure of individually identifiable health information. Business associate functions or activities on behalf of a covered entity include claims processing, data analysis, utilization review, and billing. When a covered entity uses a contractor or other non-workforce member to perform business associate services or activities, the rule requires that the covered entity include certain protections for the information in a business associate agreement. The privacy rule protects all individually identifiable health information held or transmitted by a covered entity or its business associate in any form or media, whether electronic, paper, or oral. Individually identifiable health information is information including demographic data that relates to 1. The individual's past, present, or future physical or mental health or condition, 2. The provision of health care to the individual, and 3. The past, present, or future payment for the provision of health care to the individual. What are the penalties for noncompliance? The Office for Civil Rights may impose a penalty on a covered entity for a failure to comply with the requirement of a privacy rule. Penalties will vary significantly depending on factors such as the date of the violation, whether the covered entity knew or should have known the failure to comply, or whether the covered entity's failure to comply was due to willful neglect. A person who knowingly obtains or discloses individually identifiable health information in violation of the privacy rule may face a criminal penalty of up to $50,000 and 1 year imprisonment. What are the administrative requirements? There are 8 administrative requirements as follows. 1. Privacy policies and procedures. A covered entity must develop and implement written privacy policies and procedures that are consistent with the privacy rule. 2. Privacy personnel. A covered entity must designate a privacy officer responsible for developing and implementing its privacy policies and procedures, and a contact person or contact office responsible for receiving complaints and providing individuals with information on the covered entity's privacy practices. 3. Workforce training and management. Workforce members include employees, volunteers, trainees, and may also include other persons whose conduct is under the direct control of the entity, whether or not they are paid by the entity. A covered entity must train all workforce members in its privacy policies and procedures as necessary and appropriate for them to carry out their functions. 4. Mitigation. A covered entity must mitigate, to the extent practicable, any harmful effect it learns was caused by use or disclosure of protected health information by its workforce or its business associates in violation of its privacy policies and procedures or the privacy rule. 5. Data safeguards. A covered entity must maintain reasonable and appropriate administrative, technical, and physical safeguards to prevent intentional or unintentional use or disclosure of protected health information in violation of the privacy rule, and to limit its incidental use and disclosure pursuant to otherwise permitted or required use or disclosure. For a detailed explanation of safeguards, please watch my video, Important New Cybersecurity Guidance for Healthcare. You can find the link in the description. 6. Complaints. A covered entity must have procedures for individuals to complain about its compliance with its privacy policies and procedures and the privacy rule. These procedures must be explained in its privacy practices notice. 7. Retaliation. A covered entity may not retaliate against a person for exercising rights provided by the privacy rule, for assisting in an investigation by Health and Human Services or another appropriate authority, or for opposing an act or practice that the person believes in good faith violates the privacy rule. And 8. Documentation and record retention. A covered entity must maintain, until 6 years after the latter of the date of their creation or last effective date, its privacy policies and procedures, its privacy practices notices, disposition of complaints, and other actions, activities, and designations that the privacy rule requires to be documented. Thank you for your time.